I'm Dr. Fazil. I'm internal medical specialist as well as nephrologist. Nephrologist, medical doctor of kidneys and bladder. So basically, I'm going to talk today about very important topic: dehydration. Folks, the topic. This is March 2026 edition of Dr. Fazil TV show, by the way. So now, moving forward, we discussed earlier, like we start talking about dehydration. So dehydration is a very important topic. Having less fluid in the body is known as dehydration. So, and you can get dehydrated in summer very quickly without knowing it. So what are the ways you get dehydration? Lack of fluid input, right? You don't have water, or getting sweating. You can lose a lot of water through sweat. And there's another very common source which people do not recognize is insensible perspiration. You know, basically without sweating, you have water directly leaving your skin, and that's where people get confused because they think I didn't have any, sweating. How did I become dehydrated? So that's another mechanism through which you can lose water. Obviously, vomiting and diarrhea, that can also lead to dehydration. If you have all that, it's really a bad combination, right? So you shouldn't be outside in the heat or trying to get, a situation where you can you can have access to water. Well, what are the places where you don't have access to the water? If you are very sick and in the hospital, unable to communicate and not able to recognize that you're thirsty or need water or not able to reach to the help, hospice, unconscious, being on the floor for many days. If you have a fall and nobody's able to help you out and pick you up, that all can lead to dehydration. So it could be very dangerous, could be fatal as well if it's not fixed. It can cause lack of blood spread to the brain, make you unconscious, shut down the kidneys, break down the muscles, and a whole other lot of things. So now you want to know that, okay, don't get dehydrated. You can get dehydrated without you being aware of that, and it can present. Earlier sign could be dizziness, blurred vision, and lack of balance. So don't go into the situation which can cause dehydration. Be aware of early sign of dehydration, and next, stay close to the water source. And if you become too much dehydrated and you're simply replacing with the plain water, it can cause electrolyte imbalance. So obviously you need to want to have a electrolyte intake with it. For example, electrolyte water or some salt with the water, so your sodium is not getting too low. So those are the treatment and sources of dehydration, and then the side effects of dehydration. Again, side effects of dehydration are like low blood pressure, passing out, syncope, muscle breakdown, even kidney failure. So kidney failure is one of the cause of kidney failure is dehydration. So if you have swelling in the legs, that means you have enough water. Maybe you're okay. But if you're already in the balanced state, you're not have fluid access, then dry heat can make you dehydrated very quickly. So folks, on that note, stay hydrated. You should produce around 1.5 to 2 liters of urine a day. That's kind of normal. The first sign of dehydration would be that urine output drops, you're not making too much urine, and also urine become more concentrated. So it's going to look more yellow because now our body is trying to conserve fluid. So that's the sign. If you see that sign, that means you're getting dehydrated. So drink enough fluid so you can get the kidneys opened up, and the urine output will start to get better. So for folks, on that note, that was a little instruction about staying hydrated and staying out of trouble. So on that note, I will call it a day. God bless you. God bless America. And I will be back next month with more useful topics. Thank you so much for watching Dr. Fazil TV show. Thank you.